All right, welcome everyone. I'm Sandy Lerman. I'll be your presenter tonight. If you are not familiar with me, I am the founder and the director of Heartstrong International. We're a global education company working with parents and teachers primarily, those who work with children who are experiencing anxiety, trauma, adverse childhood experiences, and who have behaviors that are really challenging for that reason. And we're using a trauma-informed, brain-based, compassionate approach to support children, to really help them regulate their nervous systems, be in relationship with the adults that care for them, and then over time gain resilience and gain the skills that they need to be successful and to thrive. So that's who I am. I would love to meet each of you. If you'll just type in the chat what your role is, if you're a parent or a teacher, and tell us where you are calling in from, what part of the world you're in, what city or state or province that you're calling in from. So I will take a look at that right now. Sometimes I have to, oh, there we go. Now I can see. A parent in Florida on the beach. Love it. School counselor from San Francisco Bay Area. Excellent. Both a parent and a teacher, but attending mostly as a parent in Denver. Excellent. Canada, Alberta, and a parent and a teacher. Great. All right. Yeah, a lot of the folks who come to us here are both parents and teachers. I love both populations. I am a parent, and I'm also a former classroom teacher, but of course I teach teachers now. I do trainings for teachers, but there's a special kind of a bond that I have with educators because I know the kinds of struggles and challenges that you face on a daily basis. And I'm hopeful that tonight we're going to talk about how important that collaboration is between parents and teachers, making sure that we're all on the same team to support kids who are struggling. We also have British Columbia, Canada, educational assistant, a teacher in the tech world. Excellent. All right, let me go back to our presentation. So I want to warn you, I have a little bit of I think it's just a cold. We'll just call it a cold. I've already had, checked for other viruses and things, but I'm coughing a little bit. I've got my hot tea. Hopefully that will get me through, but we may have to take a little break if my voice goes out. So just a little FYI. All right, so the title of tonight's presentation is Helping Anxious and Depressed Teens When Nothing Seems to Help. And this is, I think, a really important topic because there's so often that, we get a lot of good advice as parents and as teachers on what to do. We try a lot of things. Sometimes those things don't work the way we would hope that they work. And then it becomes very frustrating and very challenging for the adults and also for the children. So we're going to talk about kind of what I'm going to tell you some of my stories. Maybe you can share some of your stories. We're going to collaborate to come up with ideas of what really works to help kids who are struggling, who are really in the severe kind of mode of anxiety and depression. Pardon me. So we've already introduced ourselves. And I just want to, I said use paper and pen. Well, probably because we're a smaller group, we may have some time to open up and just have discussion, but you may want to write some things down. Again, I will provide the recording for those of you who signed up for this, or if you're part of the Trauma Informed Changemakers book club and community, you also will have access to the recording as well. So our goals today, we want to understand the prevalence and the challenges of childhood anxiety and depression. We're going to recognize warning signs and symptoms when things, aren't going so well. Avoid what doesn't work and do what works. So that's what our main focus is going to be tonight. Find hope and healing even in the most challenging circumstances. Gain perspective and know that you're not alone, right? There's several of us here in this workshop, which tells you right there that you're not the only person who's struggling with this. If you're here or if you're a teacher and you're working with kids, you know that this is a growing and a pervasive problem in our schools today for lots of reasons, which we aren't going to go so much into the causes, but we're going to talk about symptoms and what to do about it tonight. And we're also going to learn about options for further learning and support. So at the end of the presentation, I promise to give you additional resources and ideas for how you can continue on your journey. So I want to ask you this, and you can either unmute or you can type in the chat. What does anxiety and depression look like in your child or in the children that you teach? What are some things that you see? What are you observing when you have kids with anxiety and depression? So I'm gonna look in the chat and see if there's anything in there, or you're welcome to unmute yourself and just say it out loud. Complete mental and physical shutdown. Yes. And we're going to talk about mental and physical tonight too. They look antsy. It's hard for them to sit still. Yeah. So some kids, when they're anxious, they're moving around. There's a lot of movement. For some kids, it's just shut down and it's a freeze. So it's that fight, flight, or freeze. We have kids who have extra activity or aggression. Sometimes it looks like aggression. Sometimes it looks like just withdrawal. Trying to get out of things, right? So avoidance of tasks, avoidance of schoolwork, avoidance of chores, avoidance of any kind of directions from anybody, any adults. Extreme lack of motivation. Yeah. Just losing any desire to accomplish any goals almost. Yeah, these are great. And again, you're welcome to unmute and talk about what you see either in your own children or and you don't have to give names. You don't have to name the child, but if you want to tell us like about a student or a child that you've seen, and what are some of the challenges or some of the behaviors that you're seeing? Curled up in her bed in a fetal position. Yeah, it's so tough to see our kids that way. Panic attacks, absolutely. Yeah, and I like to call them panic attacks. I think people kind of understand what that means a little bit better than just saying they're having a trauma response to something or they're having a meltdown. You know, a lot of times we associate meltdowns with children who have developmental delay or autistic children sometimes will have meltdowns that are related to a disability. But often I think there's an overlap between kids who have disabilities and kids who have anxiety because it makes people anxious when they have a disability and they can't communicate or they don't understand what's going on, and that can cause anxiety. So I think there is overlap. But yeah, I think people understand if you say, oh, my child's having a panic attack. People get that because they may know other adults who've had panic attacks. It's a little bit easier to explain than kind of going into all the biological underlyings of meltdowns. Loss of breath, high heart rate, sweating. Yeah, and it's funny that you mentioned that because my son, here, and I'll tell you more about my son. I always bring him into the discussion. I think my dog has decided to leave the room. That's what the click click is. He has very high heart rate and sweating and all those kinds of those symptoms that come with the high heart rate. And his face would turn red. And for a really long time, everyone assumed that was part of his anxiety because he clearly does have an anxiety challenge, disorder. But turns out he also has Graves' disease. So I think it's really important, and we're not going to talk about medical things, but it's really important when a child has anxiety or depression, we always want to check to see if there is any other medical reason for some of the symptoms that they're having. Because some of those symptoms, just like disabilities and anxiety can look the same kinds of behaviors, sometimes there's medical issues going on. And medical, I don't know, when I don't feel well, I get kind of anxious and depressed. So if you think about that, and our kids, they don't always know what's going on in their bodies. So we need to be really careful not to assume that it's just anxiety or depression, although that can be physically debilitating as well. Great discussion. Yeah, and again, you can unmute and you can tell us stories about things, and if you have questions that come up, you can type them in the chat, and I'll pause to answer those. All right, so NAMI, if you're familiar with NAMI, an organization in the U.S., National Alliance on Mental Illness. They say that 1 in 6 children aged 6 to 17 experiences a mental health disorder each year. So if you're a classroom teacher, think about 1 out of 6. Think about how many children are in your classroom and then do the math and figure out, that's the percentage of how many children in your room have a disorder, right? And a disorder means it's at a severe level. If you have a clinical anxiety or clinical depression, that's a disorder. A lot of our kids are just experiencing anxiety because of circumstances that they're in, and it may or not become a disorder. But they still may have some anxiety because of situational anxiety, right? The pandemic, of course, has caused a lot of anxiety and depression in adults and children alike for lots of reasons that we're not going to go into, but it's not always a disorder. But you can assume that a large percentage of the kids that we're dealing with have some degree of anxiety or depression. And the other statistic is that somewhere between 15 and 20% of youth will suffer from at least one depressive episode before they reach adulthood. So that's a lot of kids. It's a lot of kids that we're talking about. And it may or may not be obvious, but we need to be on the lookout. So let's talk about warning signs and symptoms. Some of you mentioned some of these already, but just to make sure that we're aware of as many as we can be, we want to look at really 3 different areas. There are obvious psychological symptoms. Kids may have fears or worries. They may seem hopeless. They may seem down and sad. They may have shame. They may have self-loathing. Lots of psychological thought patterns and beliefs about who they are and how the world is interacting with them. Those are definitely symptoms. So if a child is talking about nobody likes me, I don't have any friends, I don't want to be around my friends, if those things are going on, that could be psychological. There are also physical symptoms, which I mentioned that, children who have lots of illnesses, it could be either a cause or a result of depression and anxiety. So if they're getting stomach pains, or they're having difficulty eating, or they're eating too much, or they have sleep problems, sleeping too much, not sleeping enough, fatigue, headaches, other pain, racing heart, all those things are physical symptoms that could have medical causes, or they could have psychological causes. And then behaviors that we've already mentioned, problems at school, at home, attendance issues often come up, school refusal, academic issues, irritability, conflict, fighting, giving up, self-harm, suicidal ideation, or suicidal attempts, which we aren't going to go into in depth tonight, but I'm going to share with you some resources about getting additional training on that if you're interested. So here's a whole long list, and I'll just read through. Panic attacks, returning to behaviors of a younger child. So at Heartstrong, we use a model, we call it the spiraling stages of growth, but we often look at the child's behavior not necessarily at their chronological age, but it's at their developmental age. If they've had any kind of trauma or disruption in their development, sometimes they will revert back to those earlier ages in their behavior. So when you see that, that could be a sign of severe depression or anxiety. Persistent or frequent sadness that lasts 2 or more weeks. These are kind of the clinical diagnosis symptoms that clinicians will look at. Fears or worries about being away. So that's that separation anxiety. Fears, worries about what other people think about them, being embarrassed, making mistakes, not wanting people to look at them. Worrying about separating from caregivers, not speaking up in situations they typically would speak in. Worrying about doing well in school, worrying about their health and their safety or their loved ones, worrying about the future, going to the doctor or the dentist. We had that this week. My son is going to get 4 wisdom teeth pulled. So this has been an adventure. Things going on in the community or in the world, global warming, earthquakes, pandemics, all those things, right? Extreme fears about one specific thing. So like spiders, for example, or flying or getting shots. Concerns about dirt or germs. Obviously that doesn't apply during a pandemic, but being responsible for something terrible happening. And a lot of times kids take that responsibility, even if it's not their fault. So if something terrible happens, a lot of times they think, if the parents get divorced, the kids will internalize that and think that they were the cause of the divorce, they were the cause of the bad thing that happened, right? Avoiding or refusing school or other activities, dropping out of their clubs and things, seeking a lot of reassurance from parents and teachers, excessive washing, checking, redoing, having to do things in a certain order or routine, extreme irritability, drastic changes in mood, social anxiety, destructive and out of control behavior. Headaches or stomach aches, trouble concentrating. So a lot of times kids will get diagnosed with ADHD, or people will suspect ADHD, but the reality is that the child may be very anxious or very depressed, and they're just irritable, and they're having a hard time focusing, and it could be a mental health challenge, not a learning disability or ADHD. Fighting with family or friends, drug and alcohol abuse for our older kids once they get access to those things, hopelessness, loss of interest in their hobbies, hearing voices. My son hears voices, and for a while I thought maybe he has schizophrenia because he was hearing voices quite a bit. That's not always a diagnosis. Sometimes kids who have had traumatic experiences will just hear things because of the trauma, not because they have a diagnosed schizophrenia or anything like that. Isolation, withdrawal, the fetal position thing, acting distant, hurting themselves, self-harm, wanting to hurt others, talking about death, talking about suicide. Okay, so let's talk about the things that we usually try or things that people recommend when we have a child who's anxious or depressed. So the most obvious one is therapy. For younger children, often they will be recommended to go to play therapy or what's called theraplay. Lots of different modes of that, but usually some kind of therapy that involves using toys or using dolls or using drawings to kind of play and use that childlike communication. There's cognitive behavioral therapy is probably the most common kind of talk therapy, dialectical behavior therapy, lots of different modalities of just sitting down and working through the anxiety and the depression, right? Medications. So lots of times when folks are depressed or anxious, immediately we think, okay, we need an anti-anxiety medicine or an antidepressant. There's lots of different classes of medications. And for those of you who have kids with severe mental health challenges, you know that this is not always a very easy solution. Sometimes you have to go through a lot of trial and error. Some of the meds make things worse for some children. And so we had a terrible time with this. We had a terrible time with therapy, and we had a terrible time with medications because a lot of the medications that are supposed to reduce anxiety, they also reduce inhibitions. So a child who felt too anxious about doing something that would be destructive, you're reducing the anxiety about the things we want to reduce the anxiety about, but we're also reducing their anxiety about, for example, taking a gun to school and shooting people at school, right? There are many cases where children who were put on anti-anxiety medications ended up doing lots of really destructive and aggressive behaviors. So that's what happened to us. Every anti-anxiety medication that we've tried has been really worse than not being on meds in our case. And that's not to say that's true for all children. It really depends on their genetic makeup and their biology and how they're going to respond to things. Sometimes medications are really important and sometimes they're very helpful. So it's not to say there's anything wrong with therapy. There's nothing wrong with medication. It's just that they're not always that easy. They don't always fix things immediately the way we would hope they would. Discipline. So a lot of times parents and teachers will try to incentivize children or give them consequences for these behaviors or even bribes, treasure box rewards if you can stay in your chair and not, and do your work, those kind of things. But if you've been around Heartstrong International for any length of time, you know that my philosophy is that rewards and consequences don't really help at all in the long term, and they often will make things worse. And we'll talk about why that is here in a minute. And then conversations, just kind of sitting down with the child and saying, hey, this seems like you're having a really tough time. What's going on? What can I do to help? And just trying to work things out. And that can be helpful, but sometimes the child will shut down and they don't want to talk about it, right? or they talk about it and you've come up with a solution, but it doesn't seem to work consistently. So those are the most common things that people do. And then when it comes to the school, a lot of times kids with anxiety and depression will refuse to go to school, or they'll have lack of attendance. They'll go less frequently than typical kids would go. And then the school tends to use a more punitive approach because of state law or province law, wherever you happen to live in the world. They have to send out truancy officers, or they have to send somebody to check on the family through child services to make sure the child is not being abused or neglected, and that the parents are doing everything that they can do to get the child to go to school. And so they try to use incentives, they try to like kind of bribe the child to go, other kinds of approaches. And then eventually a lot of kids end up just not going to school anymore. And in our case, we chose to do homeschooling, but you may just change to a different school placement, find a therapeutic school, that kind of thing. So that's it. Often and almost always affects what's going on at school if a child has severe anxiety and depression. So I think it's really important. Ross Greene is a very famous expert who talks about the difference between a won't versus a can't. It's not that children won't do things, right? It's not that they're being defiant or manipulative or trying to push our buttons or trying to be disruptive, right? Usually we need to look at the underlying causes. And a lot of times when kids have anxiety and depression, it's not that they won't go to school, it's that they can't. Like they really physically and emotionally can't access those coping skills, can't access their energy, can't access the dopamine and the serotonin in their brain in order to do the things that we're asking them to do. So having a deep compassion for that is really essential whenever we're dealing with this issue. So a lot of times adult caregivers will assume that a punitive approach, giving consequences for not attending school or giving consequences for not doing chores or whatever it is, or incentives, that, well, let's be more positive. If we give rewards, that's not going to be a negative thing, right? The problem with incentives is that we're assuming that we're trying to motivate the child. And somebody early on mentioned lack of motivation. So if a child has lack of motivation, if we try to give them an external motivation, it's likely that the lack of motivation is not related to the reward. It's related to not having the motivational hormones, the things that make your body and your brain be able to do things. They're not able to do that. It's not that they won't do it, right? So we can't motivate somebody out of anxiety. You can't motivate somebody out of depression. You can't say, if you get out of bed and have a happy day today, I'm going to give you $5. I mean, they might do it once or twice, but over the long term, it's not going to be sustainable to just continually bribe people to try to get them out of their depression, their anxiety. And if you think about yourself, like when you've had a really bad day, if you've been depressed or anxious, somebody giving you a reward for doing something, there's not enough money you could pay me to go bungee jumping. I'm not going bungee jumping. I have too much anxiety about that. I'm just not going to do it. It's not that I won't do it. It's not that I'm being defiant. It's just that I literally can't, my body can't do that. I would not be able to make the jump or jump out of an airplane, or at this point in my life, even ride a roller coaster, although I used to love roller coasters, right? So there are things, for a child who's experiencing anxiety or depression, we need to understand and have empathy and realize it's not that they're doing it on purpose. They really are having a hard time. It's a nervous system thing. It's that nervous system. Polyvagal theory teaches us a lot about how the body and the brain are so connected that the body just sometimes won't cooperate if the brain is shut down, and vice versa. So let's talk about what makes things worse, and then we'll talk about what makes things better. And I'm going to ask you to participate in this too. So think about in your situation with the child that you have in mind, whether it's a student or your own child. Think about things that you've tried that have made things worse and things that you've tried that have made things better. And we'll share those together, because I'm a parenting expert, but I don't have all the answers. I think I learn more sometimes from the clients and the students that I work with and than even from my own experience. So I would love for you to share your experiences as well. So we've already talked about how consequences or punishments make things worse. It just makes them be more anxious and more depressed, because now not only are they sad and unhappy and anxious and scared, but now they're ashamed, right? And using shame and punishments doesn't make anybody feel happier or less anxious. And then rewards or bribes. The thing about rewards or bribes, and we've all used these. I'm not pointing fingers at folks that do this, because I did this in my classroom for years. The problem with rewards is that it's the FOMO, it's the fear of missing out. So it increases the anxiety in kids who have anxiety, knowing that they have to do certain things and they have to be perfect at them, in their minds anyway, knowing that they won't get their reward if they don't do the thing, puts more pressure on them to do the thing. And then that causes increased anxiety because they're so afraid that they're going to miss out on the thing. And I just talked to one of my private parent clients today, parent coaching, that I'm working with her and her son, and he was having a terrible time at school because they have prize box time, or they have choice time where they're allowed to do, it's kind of like an extra time where they get to play games with each other and do things that they want to do. But if they don't finish their work during class time, they have to do their classwork during choice time. And so he missed a couple of days of school because of anxiety about school and school refusal. And then when he got back to school, they took away his choice time and he had to do all of his makeup work during choice time. So she and I talked about it, and she did call the school and just tell them, like, look, this kid's not coming because he's anxious. So taking away his choice time is just going to make him more anxious about coming to school. So you really end up shooting yourself in the foot when you put rewards, because you're assuming that they're always going to get the reward. And a lot of times kids with anxiety aren't going to earn their reward because it's a can't and not a won't. And now you're into that cycle of increasing the anxiety, increasing the behaviors, and it's just a bad feedback loop. Another thing that makes things worse is to assume that anything on that list that we talked about before, the things that we generally look to solve the problem, therapy, medications, having a conversation with the child, not any one of those things one time is not going to be your magic bullet to fix the problem. It's going to take a comprehensive approach. It's going to take teamwork. It's going to take a lot of patience and working through, and it's a process. And we need to give it time and be really super patient, but not just, I see a lot of parents just say, well, what medication is going to stop this behavior? It's like, there's not one medication that stops behaviors. The medication helps calm the nervous system sometimes so that you can then have conversations and solve problems together. But that one thing is not going to solve all the problems. And same thing with therapy. Sending a child away to therapy is not going to solve the problems. I see a lot of teachers do this. They'll say, oh, well, send them to the counselor, send them to the school counselor, send them to the mental health counselor. But you still have to work with that child in the classroom to teach them those social and emotional skills in the context of where they're going to be using those skills. Counselor can do a worksheet with them one-on-one, but that's not teaching them in that context, right? So that doesn't work. So sending a child or teen to therapy without the parent or the teacher also being involved in the treatment and support plan is not a good idea. I often have parents who, before they come to me for parent coaching, they have sent the child to therapy on their own. The parent's not in the therapy room. The child's going to the therapist with the assumption that that therapist is working on fixing the problem, right? And I think for older teens, sometimes that can be inappropriate if the teen has a really good rapport and good relationship with the therapist, and the therapist has a good relationship with the parent, and everybody's on the same page. That can be really helpful. But a lot of times our younger kids just can't access that kind of talk therapy in the way that's going to be helpful, and it can cause additional problems because you can do triangulation, which is like the therapist is on the child's side and the child's saying all these horrible things about the parent when we don't really know what the parents' views are and what their perspective is. And so I think that if you're going to do traditional talk therapy, family therapy or adoption therapy or something like that is often a lot more appropriate. And then any treatment plan that's not trauma informed, which trauma informed approaches take into account that those underlying causes, the understanding the function of the autonomic nervous system. If they're not doing that, if they're just assuming kids are misbehaving, then that's not going to work. So I see a comment in the chat. It says, my child wanted the magic fix from the time she was 11. It took her till 25 until she realized that she needed to do the work. Yeah. Sometimes, I think it's true for adults too. I mean, we all of us want solutions that are going to make bad things go away as quickly as possible, right? We all want that. But really doing the work is a collaborative process. It involves everybody that's in that child's life and the child, and they have to be on board, right? And so it sounds to me like your daughter really wasn't on board with the plan of doing the therapy until later in life. And I think that's really very typical, honestly. I think most teenagers are so self-centered. I mean, that's just the way their brains are. Their brains are not fully developed until they're 25. So they don't have any concept of, why do I need to go get fixed in therapy? My problem is that my parents don't understand me. My problem is that my teacher doesn't understand me, right? It's this very self-focused kind of thinking, which is very developmentally appropriate for them. So with that understanding, just sending them away to therapy, as parents, we need to be really realistic and understand that's not the quick fix too. But it's great that she finally realized that she had some things that she had to work on, which is fantastic. All right, so other things that make things worse, treatment and support that isn't culturally proficient. So this can get really sticky. So for my son, my son has a lot of differences, let's just say. He was adopted, he's internationally adopted, he's deaf, he uses sign language, he's transgender, so he has lots of cultural things and differences of the way he is in the world, that when he shows up to a hospital or something, or he's getting treatment from a new doctor, there's a lot of layers of cultural proficiency that a lot of folks don't understand in how to work with him in the best, most appropriate way. It's going to make him feel that he's not being discriminated against, or that he's not being looked at as a weird person or abnormal or strange, or those deaf people, they're strange, and why would you need an interpreter, and all the things, right? We've been to hospitals that had no Black and brown people working there, and that was really not good. We ended up finding hospitals and places where we could go where he felt more comfortable, and the people there seemed to listen to him and treat him in a better way. Unfortunately, there is still a lot of institutional racism out there. So being culturally proficient is really important. And ideally, he had a deaf counselor at one point. She was a white counselor, but he had a deaf counselor. He had an LGBTQ counselor who was deaf at one point. It's hard to always get a counselor who's going to understand everything. But at least if the counselor, he had one counselor who was Hispanic and hearing, not deaf, didn't know anything about deaf culture, didn't know anything about LGBTQ, but was very, very open-minded and very flexible and understanding and interested in learning, and just very easy to talk to and engaged, and he just felt super comfortable. So it doesn't necessarily mean that you always have to go to people who are the same affinity group that you're in, but understanding that children, they need those role models. They need to see that they're not alone, that they're not the only one, right? But they also need people who aren't like them to understand who they are and where they're coming from. So that's really, really important. So if you're in a school and you have one child who's from another country or something, and they speak a different language, and counselors are trying to work with them, you might need to bring somebody in from their culture who can understand a little bit better to help you navigate some of that. Especially with international adoptees, I've had several international adoptees whose parents I've worked with, and they brought in translators, but they also brought in people who were more like mentors, who were from that person's culture. And I think it's really helpful to do that. And then treatment and support that isn't collaborative with both parents and educators. When there's pointing fingers, this can cause problems, and it's so hard to avoid. Parents blame teachers, teachers blame parents, but we've got to get on the same page, or else the child suffers. That's just the bottom line. So There's another comment here. We're talking about the magic fix, and someone said the underlying cause is the issue. Our daughter is adopted, and we think this is where this comes from, but we do not know for sure. This is one problem we have. We need to identify the root of the issue. To the person who said that, and I'm not saying names just for confidentiality, but you may want to check out, I did a whole 2-hour training on the roots of behavior roots. And so I can give you information about how to access that. If you're part of our community, so some of the folks that are here tonight are part of the Trauma Informed Change Makers Book Club and community. That is a membership program, and they have access to all of the old workshops and trainings to watch again and again as many times as they want to. And so if you want to join that community, you'll get access to that workshop and several other workshops on different topics. And of course, there's also parent coaching, private parent coaching, and we could talk about that if it's something you'd like to do. And then we had another person say, once you find the root, time makes those roots go deeper and deeper, more difficult to dig up and unroot. Yeah, I think that's true. I think depending on what the root is, I think awareness obviously is the first step. Once you know what the root is, then you can start to look for, okay, so maybe adoption, maybe especially for international adoption or transracial adoption. If, I have a Hispanic child, and so everywhere we go, we stick out like a sore thumb. I'm a white single woman. I have a Hispanic child who happens to be deaf, and we use sign language. So we're like a little circus. Everywhere we go, everybody stares, and it makes Hero very self-conscious. But I think for example, we will go to the Guatemalan store to buy tamales, which is one of his favorite foods. And he loves going there. It's not just the tamales, it's being a brown person in a brown environment. Like there's mostly Hispanic people, mostly Guatemalan people in that store. And it just gives him a chance to relax and be like, oh, I'm around people that look like me. Now, when I walk in that store, I feel a little anxious because I'm like, okay, I'm this white woman walking into the Guatemalan store. I stick out like a sore thumb. And so it's great for me to experience that, because for our transracial adoptees, that's what they experience on a daily basis, that feeling of being the other. Even if nothing is said, even if everybody treats them nicely, there's just a feeling of I don't look like these people. I'm different. I'm not sure if they're going to accept me. And I don't know if I accept myself, right? So there's lots and lots of layers for adopted kids, culturally, racially. And then the whole adoption itself is very traumatic. Taking a child from my son was adopted, so I put myself in this category. We who are adoptive parents, we've removed our children from their first parents. For reasons of trying to help, right? But that's still very traumatic to be taken from your birth mom, from your biological mother. It's just a trauma, and so we're part of that. And then everything that happened to the child before the adoption itself was probably traumatic, because that's why they're being placed for adoption. And then a lot of our kids have been through medical treatments and things, and that's traumatic. So there's looking for the root, for the trauma root is part of it, but then also looking for situational things. And I'm not going to go into the whole training, but I talk about looking at the unmet needs, the unsolved problems, the lagging skills, limiting beliefs, and systemic barriers, looking at all of those things to see what could be the cause. We need to teach a skill. Do we need to meet a need? What do we need to do to solve that with a child? So other things that make things worse, blaming the child or blaming ourselves for perceived failures. It can be very discouraging when you've tried all the things and they're not working. And then you're like, well, this kid is just lazy. This kid just doesn't want to get well. It's their fault. You don't want to do that, because again, it's not a won't, it's a can't. For some reason, they're not accessing that. And then we don't want to blame ourselves, because if we're really trying, it's not always that easy. It takes some time, it takes some patience, and blaming doesn't help. Nagging, bribing, forcing anything at all. This is a huge one. I think a lot of parents and teachers get exasperated and frustrated with kids when they're not doing what they're supposed to be doing. So they start getting very naggy and very, my way or the highway. We call it plan A parenting sometimes. That tends to make kids dig in their heels, and it tends to make the anxiety and the depression worse, not better. Um, it's natural to feel like you need to do that, because especially when you're having pressure from, so if you're a parent, you get a lot of pressure from the school to make things better, to get this kid on track. And if you're a teacher, you're getting a lot of pressure from the parents to make things better, get this kid on track. So there's lots of pressure to get this kid on track. And then a lot of times we take it out on the child, and it's not productive. And I've been in that situation on both sides of the table, and it's just not productive. And it makes things worse for the child. And then giving up hope is not helpful, right? We don't want to give up hope. We want to say, okay, this is just the end of, like, this kid's just never going to get any better. Just have to, oh well, and losing that hope. But finding that hope is really key for me. That's been the biggest key for me, is like just realizing that my hope is sometimes the only anchor that we have to work with. So here's another comment. Yes, my child's high school just told me today we need to look for another school as her needs are too great for the public high school. 3 hospitalizations for SI this fall. Yeah. Well, it's one of those things where sometimes you need to fight the systems and say, no, you are equipped and this is what you can do. And they have an IEP, the child has an IEP, and this is what we've talked about. And you can navigate that and fight for that and advocate for that. But it is exhausting. And I say that from experience, that I have been at those IEP tables where they were just like, well, we can't, nothing more we can do. We're going to have to send them to a therapeutic school because, it's not working here. And sometimes that is the best placement, right? So it's hard to know sometimes if we had a magic wand or magic ball and could predict the future, what's going to make this kid do better. We would do that, obviously. But I think most important thing, and we're going to talk about what does work here in a minute, but in those cases with school placements and school meetings and things, trying to stay in an attitude of teamwork in as much as it is humanly possible. Sometimes it's hard because everybody feels so exhausted by the problem, but the more you can get an ally or two. In my case, we had one teacher who was really good about advocating for us on my child's behalf at the school. And that can be really helpful, so that you're not the only one telling them, this is what my child needs. This is what, because we come across as helicopter parents. We really do. They think that we're, I had a dentist that said to me the other day that we are over advocates for my kid. And I just laughed at that, because if he had known what we've dealt with over the years, he would know that my child would be dead now if I weren't advocating for him at the level that I advocate for him. So I understand that most parents, teachers, doctors, dentists, they don't have the same experience that I have or that you have. And so having a little grace and patience with them and saying, okay, they just don't really get it, and kind of letting that roll off. But sometimes it's, you don't have a lot of choice, and you don't have a lot of control over those educational things. And that can be very, very frustrating. So I want to ask you all, what have you tried with your child or teen that has seemed to make things worse? And then we're going to go to what's going to make things better. We don't want to spend too much time on this. We're going to talk about what makes things better, because that's why we're here tonight. But quickly, just in the chat, what are things that you've tried that did not work? Talking to your child makes things so much worse. Yeah. Sometimes I think our kids feel really threatened by talking. So I teach in my parent programs and in my training. I have a trauma-informed specialist training. We talk a lot about how to get kids buy-in and how to kind of get them on your team, be on the same team when you're having those conversations. But it's tough. Like my son will shut down and get completely quiet when he's anxious. So it is very, very hard. Setting firm boundaries. Yeah. Showing your frustrations. Yeah, setting firm boundaries. Someone said that. I think that's a really good point, that when you set the boundary and you set up a rule, then eventually they're going to break it. They're going to break the rule. And then what do? Then you have to consequence, right? So I try not to make things hard and fast. I try to really make things very flexible. It doesn't mean it's just free for all, do whatever you want. But there are times when I, quote, drop the rope. I just let go of any kind of conflict because it's not worth going there until they're calm and I am calm and we can have that discussion. Showing your frustrations, come up with a plan without the student. Yes. Or the child, right? If you, the adult, make all the decisions for the child, first of all, they're going to resent that. And secondly, they're going to feel no sense of autonomy and they're not going to learn how to solve problems. And so we definitely want to get student or child buy-in. We definitely want to enroll them in these conversations and make sure that they're participating in coming up with a plan for themselves. Really good point. The other thoughts on what doesn't work well? And you're welcome to unmute if you want to tell a story or share something too. All right, well, let's move on to the positive. Let's talk about what does work. I want to give you hope because my son and many of the families that I've worked with and many of the teachers that I've worked with have had lots of success with some of the things that we're going to talk about tonight. Now, does that mean it's overnight? No. Does that mean one thing on this list is the magic bullet that changes everything and turns it all around? No. Does it mean that it's going to be easy all the time? No. It's definitely a process, definitely a learning curve, and definitely requires a lot of patience and deep love and compassion for children. And really, it's really, when I think back on what we've been through, how far we've come from the early days after my son was adopted and he had massive rages almost daily and hospitalizations. And we tried all the medications and he was very aggressive and shutdowns and meltdowns and all the things, right, on a daily basis. We're now at a point where he's going to be 21 in December. Can't believe that. And he's able to communicate with me. Now, there are days if he's not feeling well, he will still go to sort of a fight, flight, or freeze kind of a mode, but it's nowhere near the level of escalation that we used to have. And it's because over time, I'm going to share with you some of the things that have worked for me, that have worked with other parents that I've worked with, just to give you the hope that yes, it is possible for kids to grow and heal over time, not to be perfect and not that we're perfect, but we can get to a point of healing and growth, and there is always, always, always hope for change. Okay. So let's talk about that. So are there any comments before we move on? I'm gonna just double check my chat here and make sure we're good. All right. So we talked about the problem of blaming and shaming, teachers blaming parents, parents blaming teachers, doctors, all around, right? And everybody blames the child. So having teamwork and compassion for everyone, mutually respectful collaboration with the child, the parents, the educators, the therapists, the doctors, everybody that is in contact with that child needs to have compassion, first for themselves, and then for everybody else that's on that team. Because it's all of us are having a hard time with this child. All of us are. It's not just the parent. It's not just the teacher. It's not just the doctor or the dentist, right? Everybody's doing everything they can do, and it's not always working, right? It's not 100% effective. So with that in mind, imagine how hard that is for the parent on a daily basis. Imagine how hard that is for the teacher on a daily basis, right? And so if we can put ourselves in the other one's shoes, that can be really helpful to start. And then everybody needs to have teamwork and compassion for the child. And this is essential. This is why in my Heart Strong framework, in the spiraling stages of growth, we always start with compassion, first for ourselves and then for the child, because you can't have a conversation with a child if you're coming at it with that sort of naggy, I'm the parent and I know best and I'm going to tell you what you need to do. They will talk to the hand. They're going to turn around. They're not going to want to listen to us. We have to start with, wow, you're having a hard time. This is really hard for you. Wow, I can see you're really, really sad. you're really, really anxious. You're not sure how to handle this situation. Wow, that must be really tough for you, right? When you start with that deep empathy and compassion, then you're going to get a crack in the door. Does that mean they're going to suddenly now have a collaborative conversation with you? No. But over time, if you do that again and again and again, eventually they start to open up and they start to see that we're all here on the same team. We're all, I say drop the rope. Don't have tug of war. Drop that rope, get on the side of the child and be on the same team to work things out together. We mentioned looking for the root of the problem instead of focusing on the symptoms. The child's having a hard time getting out of bed in the morning. Could be a sign of depression. It's very hard to sleep when you're depressed. It's very hard to get out of bed when you're depressed. If they're anxious about school, they might be thinking about, oh my gosh, I gotta go to school. Everybody's gonna look at me. I'm gonna get bullied. I have to take a test. I don't understand math. Whatever it is, there's anxiety there. So they may be avoiding that by staying in bed, right? So getting out of bed is not the problem. It's the fear of what's happening at school, or it's the depression that's making me not sleep that's causing it to be hard for me to get out of bed. So focusing on like giving them stickers every time they get out of bed or making a big deal about them getting out of bed is not how you're going to solve the problem, right? You want to sit down and figure out why they're not able to get out of bed, what's going on physically, emotionally, mentally, and in their heart, and how can we as a team sit down, talk it through, figure out a solution. Pardon me, sip of the tea. I teach a whole lot on how to do this in our Heartstrong Academy, in our Trauma Informed Specialist Program, and when I work with private parents in private parent coaching. What makes things better? Trauma-informed approaches and healing modalities for for parenting, therapy, pardon me, school, and every person and environment the child or teen interacts with. So we've got to make sure that it's not just trauma-informed at home. The parents that I work with, they're like, that's great if I'm doing this at home, but if the teachers aren't trauma-informed and they're punishing my child for being late to class in the morning every day, or they're punishing my child for not finishing their homework, or they're giving rewards every time my child does finish their homework, those are not trauma-informed approaches. And so we got to be on the same team. We got to work with the schools and with the parents, and the same thing vice versa. If the school's trying to do trauma-informed things and the parents are saying, looking at Class Dojo and saying, oh, you didn't turn your homework, well, you're grounded for the rest of the week. I'm taking away your iPad tonight. That's not going to make them feel like you're on their team. It's going to cause resentment and struggle and more anxiety, more depression. We want to use collaborative approaches to problem solving instead of rules and ultimatums, right? The whole setting a firm boundary is fine, I think, but only in the context of safety. I think boundaries are safety boundaries. You don't let the child run out into the middle of the street. You definitely want to grab them, pull them out of the middle of the street. You don't want to give a child access to a credit card if you know they're going to run up a big credit card bill. Those are safety issues because there's a danger to it. And you put strong boundaries around those things. But putting strong boundaries around everything is too much, I think. You need to have some collaboration, have some discussions, come up with solutions together. Trauma-informed approaches and healing modalities for parenting, therapy, school, and every person. Educating the child, teen about their own trauma. So this first one I forgot to mention. So trauma-informed healing for the parents too. So the parents need to be getting their own trauma-informed support through therapy, through parent coaching, through reading books and listening to podcasts and doing all the things that help you become more trauma-informed. And then also being in community with other parents that are dealing with this, I think is really helpful as well, and teachers as well. And then educating the child or the teen about their trauma, about their anxiety and their depression, and encouraging them to find and choose solutions that work best for them, individualization and respect for their process and timing. So this is really a long way to say just giving them autonomy over their own bodies and their brains and their decisions. Um, and I can tell a story about that. Pardon me. Voice is just about done here, but let me take a sip. I'll tell a story about that. My son, I mentioned before, has hyperthyroid disease, and he, for a while, was really anxious about taking the medications because he has trauma history with meds. When he was at the orphanage, he thought they were poisoning him. So he didn't want to take the medication. Long story short, it ended up better off for him in the long run. He stopped taking meds. They wanted to do surgery. He didn't want to do the surgery. Long story short, he eventually went back on the meds. We did all the things that I'm talking about now. And he got to the point where he made a decision that he wanted to take the medication because he felt like it was going to make him better. And then he got better, and then they didn't have to do the surgery that the doctor was really pushing for. And so the long-term outcome is actually better for him than if we had followed the doctor's advice the first time we had the conversation. So really, it was a long process, and it was really painful to kind of go through and be patient and have all those discussions and listen to him and give him time to process it and everything. It might not have had a good outcome. I'm not saying that it's always going to be best to let the child do what they want, but I think when the child has a voice and a choice, it's more likely that over time you're going to come to better collaborative solutions. But it was risky. It was really risky for me to allow him to make some of those decisions. I mean, doctor really wanted to force it, and we went all the way up through the ethics committee at the hospital, and we decided to let him make the choice. But it ended up being the right choice for him. So someone asked a question, what do you think of neurofeedback therapy? Yeah, we're going to talk about different kinds of therapies. And I think there's lots of alternative therapies that I think are sometimes better than traditional talk therapy. And biofeedback, neurofeedback, lots of those sort of brain, body, somatic kinds of therapies can be very healing and very helpful. Treatment and support that is culturally proficient. We've talked about this before, that if you're not, if my son goes to a doctor's appointment and there's no interpreter there, I can interpret for him, but if it's an emergency situation, that's not always the best thing. So just really being aware of what's going to be supportive of that person, whatever their religious background, sexual orientation, cultural background, language things, all those things can come into play. So just be really, really aware of that. Having a progress, not perfection mindset. So really looking at the growth instead of the achievement. Really looking at, look how far we've come since 2 years ago, when we were having massive meltdowns daily. Now we're only having them once a month, right? And so that's progress. Doesn't mean that they're gone completely, but we've had progress, we've had growth. So really encouraging children and teens to look at their own growth and not to feel like they have to be perfect. Same thing for us as adults, as teachers and parents. Like, we're not going to be perfect teachers or perfect parents, but really look at the growth and the progress. And then celebrating that growth and celebrating small victories. Instead of giving a child a reward every time they come to school, I would just say over time, let's say they missed 2 out of 5 days a week for several weeks. Well, they got there 3 times. So, a few weeks into that, you could say, you know what, I know it's been really hard for you to come to school, and you ended up coming a lot of times. I know you missed a few days, but you were here a lot, and that's amazing. Give me a high five. Like just celebrating that. It doesn't have to be a big pizza party, but you can do that. But like really just acknowledging how hard it is and looking at what's going well instead of always focusing on what's not perfect yet, right? Adult caregiver therapy, trauma treatment, and coaching. Getting your own parent coaching or teacher coaching, being in programs where people are learning strategies that work can be really, really helpful. I think in a lot of ways, my experience is that it's better, at least in my case, and in a lot of cases where I work with folks who are in my parent coaching programs, it's better to get the parent really solid in their parenting than to worry about sending the child to therapy. Now, therapy can be very helpful. Again, I'm not knocking on therapy or medication or any of those traditional things. I just think they're not a quick fix. And I think a change in parenting approach to this kind of giving the child more autonomy, having better teamwork, those kinds of things can make a huge difference in the child's ability to access things like therapy and medications and other things that might be helpful. So being in support groups of others who are dealing with similar challenges. I am so sorry about the coughing. I'm going to probably have to wrap this up a little early tonight, but I will let you know if you do have questions, if we don't have time at the end, if I have to end a little early, you're welcome to email me and I'll give you my email address, and I'm happy to reach out and talk to anybody if you have further questions on this. If you're in a support group though, I put this caveat: be sure that the participants are providing real tangible support and they have an optimistic, hope-filled attitude, not what my mom used to call the ain't it awful club, the whole misery loves company thing. You don't want to be hanging out in parent groups that are just complaining about their children all the time. There are some very toxic, I'm in some of them. I don't participate as much in the toxic ones, but I just go in to see what the vibe is, see what they're talking about. But there are some parenting groups that are very, very toxic and very, very negative towards children. I would recommend that you not hang out in those, that you find parent groups and support groups, whether they're online or in person. I'm in one, it's sort of semi in person. It's a local parenting group, but it's on Zoom right now, but it's a local group from my community here. And I really like it because it's local, and then I can hang out with them, once we get out of pandemic mode. I have had coffee with a couple of the other moms that are in this group. So, I think it's important to do local things. You can do global support groups like our groups. We have Heartstrong Parenting, Heartstrong Teaching, and then we also have our Trauma-Informed Changemakers group. So any group that you can be in where you have like-minded people that are all really concerned about their children and really want to help their children, and not just bashing and saying how awful everything is. And then reading books and articles by current trauma-informed experts who have great ideas on how to help. I'm always trying to stay on the cutting edge of that because there's always new information coming out. So I think that's really helpful. So we talked about neurofeedback. So I didn't list that one here, but that's definitely one we could add. But there are alternatives to traditional cognitive behavioral therapy and talk therapy. You can have the child do, or you as the parent or the teacher. I loved the somatic experiences. Somatic experiencing is a really excellent modality that I encourage you to check out. You can Google it to find practitioners. EMDR is another sort of trauma-informed therapy that doesn't involve talking necessarily about what's going on. Other somatic approaches, mind-body approaches to therapy that don't involve talking. Art therapy for my son, those of you who know me and have followed me for a while, art really has saved his life multiple times. He has expressed his emotions through his art, and he finds joy in art, and he finds competence and self-love through his art. And so anything that a child enjoys doing, have them do more of that. Animal therapy, equine therapy are all excellent choices. So avoiding things that cause more anxiety and depression. I asked Hero, my son, tonight, what should I put in this presentation? I told him what I was going to talk about. Is there anything that you want me to add before these folks come on? He said, yeah, tell them don't let your child do really a lot of video games that have guns and negative things going on, scary things or depressing things, dead people and gory things. He has a game that he loves and he's very good at, but it's very violent. And he suggested that I suggest to you not to let your child do a lot of violent games. Now, if I had told him to get off of that violent game before, that would have been a conflict. So it's interesting to me that he himself came up with this idea that he really needs to do more fun games like Animal Crossing and I forget what the other ones are, but they're cute games and fun games and with colorful characters, and it's not about blood and gore and killing and those kinds of depressing things. So it's interesting to me that he's learning his own coping strategies, and he's realized that staying away from those more violent games is better for him. And for the adults, for me, I don't know if you guys do doom scrolling. Sometimes I will just scroll through news feeds and I'm reading like, oh, this is the latest, current events that are happening. It's very depressing because they know that they're going to get, it's called clickbait. They're going to get more views if they talk about depressing or scary topics. So if that's all you're doing all day is reading the news, it's going to be depressing. So try to avoid, I mean, you can get your news quickly, but then go back to happy, joyful things. So the next thing is things that make things better is finding joy, doing joy-filled activities. My son and I stopped going to all mental health therapy and even medical treatment for a while, even though he has lots of medical issues with the thyroid and some other medical issues. It got to be depressing because we were almost every day we had some kind of medical or mental health appointment. And it was just, I felt like it was a biology experiment all day long, every day. And I think he felt that way too. So we just stopped going for a while. I mean, I kept up with them by phone and, email or whatever, but I just decided as a family, we needed to do some fun things instead of always going to the doctor or always going to a therapist. And so we did. So we planned some happy activities that he and I could enjoy together. I went out and bought him some more art supplies. I bought him a special art desk for his room. We decorated his room in a Christmas theme, and that's year round because he loves Christmas so much. It brings him a lot of joy. So I'm like, if you like Christmas and you're depressed, he was depressed in July because it's so long to wait till Christmas time. Like, well, we don't have to wait till Christmas time. We can do Christmas every month if that's what brings you joy. So we have Christmas trees in almost in every room. Like there's one here that was up before Halloween. We made it a Halloween Christmas tree, but now it's like a regular Christmas tree. But I've got one in my bedroom. He's got 3 in his bedroom. It's Christmas everywhere. And it's not really my favorite style, but I'm like, if it's going to keep my kid happy and make him less depressed, then I'm going to do it. So just finding things that bring joy. Always having something to look forward to, right? You got all these doctor's appointments and mental health, all these things. If you have nothing to look forward to, it's just depressing. So for us, it's always, what's the next Marvel movie that's coming out? That's our family thing. Like we love Marvel Avengers movies. And so, next one is Eternals just came out. That actually has a deaf superhero character, which is kind of cool. So we're going to see that next. And, I'm not sure if we'll go to the theater or wait till it comes out on the, streaming or not. But anyway, just having things to look forward to, like a movie that's going to come out, or what are we going to do for the holidays, or my sister's going to come in to visit. Things that we can look forward to as a family, because that keeps that forward goal setting, something exciting, something that brings that adrenaline and oxytocin, all the good, happy hormones. And then the last two, let me see, that looks like there's a comment. Let me see. Somebody said, oh, that's a great idea. My daughter loves Christmas, or at least the idea of Christmas. Yeah, my son's bedroom is like, now, right after Christmas is a good time to get a sale. Like you can buy I went to, I think it was Meijer, which is like a Walmart here, but I went there and I bought a bunch of Christmas pillows and a Christmas plush blanket and decorations. And like we will go to Goodwill and he'll buy a bunch of Christmas crap that I don't like. It's not my thing, but it's his thing, so he's got like these, I don't know, he found these antler glasses and just silly things. If it makes him happy, I don't care. Like buy as much of the crap as you want to buy. If it's only a couple bucks at Goodwill, it's not that expensive, but you can get it cheaply after the holidays. So just, you can stock up then, and then just decorate one room or decorate your child's bedroom, whatever makes them happy, and if they're into sports or something, go do that sport more often. If they're into animals, go hang out with animals. Whatever they're into is what you need to figure out and then plan it regularly. Because I just think that having joy and having things to look forward to helps get them out of that funk a little bit, even if they're still depressed, that they can go on to the next day. And it's not just such a burden. And then the last two on here are radical acceptance for whatever may happen and radical gratitude for the crumbs. And I'll tell you the story about the crumbs here in a minute. I might cry telling these stories, so I warned you about the coughing. I hope I don't have crying and coughing. So let me get my sip. There have been times, this is very personal, but I'm going to be very vulnerable with you. There have been times when I wasn't sure my son was going to make it. And I mean that in terms of his medical illness as well as his mental illness. He has had suicidal ideation, he's done self-harming. He attempted suicide when he was in the orphanage in Guatemala. He was only 7 or 8 years old. So this is a kid who grew up with anxiety and depression before his adoption, was adopted, came here, learned 2 new languages, had all kinds of other things happening, bullying at school and things happen. So he's been through a whole lot in his young life. The fact that he's still alive at 21 is truly a miracle. And there were times, like I said, that I didn't think he was going to make it. I didn't think he was going to make it. And so I had to really radically accept that no matter what I do, there may come a time when it's not enough. I can't prevent him. Ultimately, I can do all that I can as a mom, and I care about him. I love him from the bottom of my heart, from the depths of the marrow of my bones. I love him with every cell in my body. every part of my soul is connected to this child. I would be devastated if he made a choice to end his life by suicide. I would be devastated if he died of hyperthyroid disease because he wasn't able to get access to treatment because of anxiety or whatever is the barrier there. It may happen at some point, and I've gotten to a point where I've radically accepted that this is just the reality. You know, it's like having a child who has a terminal illness or any other kind of really serious illness. You don't know when something could happen or how something could happen, but you still have the hope that things are going to get better. And so I'm not saying I've resigned myself to the fact that that's going to happen. What I'm saying is that I have radical acceptance that if everything I am busting my butt to make a good life for my child. If it's not enough, then I did everything I could do. And to not hold ourselves to such a high standard that like it's my fault and have constant feelings of guilt that I can't fix it for him. So I just want to give you that gift tonight. If you're thinking, you know, I have a student that I can't help them. I'm not reaching them. I don't know what else to do. I don't want you to give up on that child, but I just want you to radically accept that you are doing the very best you can and that you can continue to do more. We can always grow. We can always continue, but you really just let go of the outcome. Have hope and then let go of the outcome and let the child bloom. Don't blame the lettuce. Don't like try to fix the lettuce. Create an environment for that child to find their own healing and their own growth. And I do believe that many of our kids are going to surprise us and delight us with what they end up doing with their lives. So give that some thought. And then the other one is radical gratitude for the crumbs of life. So this is another story I tell. It's not my story. It's actually the story of a foster parent trainer. I was in a foster parent training once, and this trainer told me the story of her husband who used to drive her nuts because he would make a sandwich and always there were crumbs all over the counter after he made his sandwich. And he never cleaned up his crumbs, and there were constantly crumbs all over. So she would have to go in the kitchen. She'd ask him to clean the crumbs. He would forget to clean the crumbs. This was a constant source of conflict. And so she would just end up cleaning up his crumbs. But she was very resentful of this, right? Like, he's always leaving these crumbs on the table. I'm cleaning up the crumbs every day. Just this resentment, just kind of simmering under the surface for years. This happened. One day he clutched his chest and he started having really bad chest pains. Took him called the ambulance, took him to the hospital, and he had a heart attack. And he was in the hospital for about a week before he came home. And she said that she got home, she went home to take a break. You know, she was with him at his bedside, but she went home to take a little break, to get something to eat, to kind of check on the house and everything. And the kitchen was completely clean. There were no crumbs on the counter. I told you I was going to cry. And she said it was the one thing that just broke her heart, that she would give anything to have those crumbs on her counter. So whatever it is that your child is doing or your student is doing that's driving you crazy, that's making you irritated, even if it's really aggressive, really, really scary behavior, just know that if that child were to be gone tomorrow, that might be the one thing that you miss the most. And your life would be different without them, right? So just having a radical sense of acceptance of what is right now and what may become, the results we can't control. We don't give up hope, but then also having a radical gratitude for those little irritations and realizing, whoops, my dog is, what are you doing, Thor? Realizing that those things that drive us crazy, they're the things we're probably going to miss the most if and when they ever are gone. And that could just be when they go off to college too. It doesn't have to be through death or suicide or anything that serious. All right. So other things that make things better, listen to your mama gut. Those of you who are parents, mamas or papas, listen to the papa gut. If you feel something is not right for your child, whether it's a medication or a treatment or something at school, don't be bullied into doing it. Listen to your gut. Listen to the little voice that's telling you this isn't the right thing. This is better. Let's try this. And then help your child learn to listen to their own gut as well. And be a strong anchor in the storm. You have to be strong in order to help your child be strong. So whatever you can do to keep yourself physically well, mentally well, emotionally well, spiritually well, all the wellness activities that you can do to help yourself be calm and having resources around you, people that love you, people that can pour into you. The more that you can do that, the better you're going to be, and the better you are, the better your child is going to be. Because a lot of our anxiety and depression can be reflected onto our children. They sense that and they take that in, and then they're going to give it back to us as well. So now the last part, here's what have you tried? I've shared with you some of my ideas. What are some other things or things on this list or other things that I didn't include that you feel have really made a difference and have helped to make things better? And why do you think they did? Why do you think they made things better? So I'd love to hear from you. And I'll stop sharing here for a minute. If anybody wants to unmute, you're welcome to do that. And tell me what you think has gone well for you. Or you can type it in the chat.
Oh, okay. Hi, Sandy. It's Tammy, how are you?
Good.
Okay, so, because I like to talk about type. I just think that maybe one thing that I do is just accept the kids where they're at. Working in a school, just accept the kids where they're at.
Yeah, because they're not there yet, and that's okay. And neither are we, right? Like, nobody's perfect. Nobody's nerfect. This is just, they are who they are. It is what it is. Let's just accept it in a radical way. And then we can always improve and get better. I think there's a quote, I saw this on a teacher's classroom wall once. It was, just because I accept you for exactly who you are does not mean I've abandoned all hope for your improving.
That's cool.
Right? So it's not that you're giving up hope that they're going to do any better. It's just that you're like, this is where they are, When I was training to walk a half marathon, I could only do a block the first week, And that wasn't, I shouldn't have said, well, I can't do this now because I'm only walking for a block. No, it takes time, it takes practice, it takes endurance. You get better and better over time. That doesn't mean you're a horrible and a failure just because you're not there yet, right? And that's the magic word. The magic word is yet. Kids do well when they can, right? That's Ross Green. If they're not doing well, it's because they can't. And then I add ... yet. Someday they may, or most likely will, be able to do a lot of the things that they can't do right now, but they just need time and patience and a whole lot of support and training and coaching and all the things, but in a loving, non-punitive, non-coercive way, in a way that they can grow and heal and figure things out. I have never had a conversation with, well, yes, I have. I think I have had a conversation with Hera about violent video games and how they can be depressing. But I planted that seed probably 5 years ago. At the time, he grumbled about it and continued to play the games, right? But now, just now, when I said, hey, I'm going to talk to these parents and teachers about depression and anxiety, what should I tell them? He said, oh, I've definitely noticed that when I don't play this, so like he thinks he thought of that, like, but I planted the seed a long time ago. But look at how it's grown over time as he's gotten maturity and experience, and he's realizing it's not a good idea for his depression and anxiety, right? So we got to give them a little more credit. And this is a kid with language delay, developmental trauma. He's got a lot of barriers, but he's smart enough to figure that out over time. Other thoughts? Things that have helped, things that are, or are there any of these things that I mentioned that you'd like to try or that you think are something that you've maybe been challenged with or you want to try or you have questions about?
Something that came to mind for me, oh, sorry.
No, go ahead.
Okay. Is just, I can't remember how you phrased it now, Sandy, but the kind of the idea of focusing on progress, not perfection.
Yes.
And I can just say, you know, as a teacher right now, as I've brought that more into my conversations with other colleagues over any student, you know, not just ones that are depressed or
anybody who's struggling.
You know, yeah, just struggling kids. Focusing on progress and how, you know, even as they go on in years, that we're seeing more maturity in areas. So, for example, I have a student right now in my class who has a lot of challenges, and I've been talking with my colleagues about how, well, what was he like last year? Or what was he like? I'm a grade 4 teacher. What was he like in grade 2? And just kind of contrasting that and going, oh, look, he's already improved a lot.
Yeah.
So look how far we've come so far. And that is actually not, and it's made me think, is this something I've missed as well? But I find my colleagues, and I'm not trying to put them down, they're awesome people, but they're like, yeah, we never thought of that. We're just looking at the here and now, like what's in class right now. Okay, it's challenging. But when you look at, you know, maybe there's other strategies that we've used and we didn't really know, we didn't see instant progress or instant success. And we certainly didn't see this child meet every expectation that we would hope for every student, but they've made progress. And yeah. I actually find that is actually for my thinking, it's really key. I don't know what the word is, but like it's changed something.
It's paradigm shifting. I mean, it really is paradigm shifting, because if we could look at really all human beings, not just children, if we could have grace and love and compassion for everybody and realize that they're really doing the best they can wherever they are right now, but they can get better, but they're doing the best they can right now. And so accepting that and then looking back at where they were and seeing the progress progress in Canada and really understanding that that's to be celebrated. And that's a natural. And we, you know, those of you who know me, we do the spiraling stages of growth. We talk about when we have progress, we're starting at this bottom rung and we're going to go up to the next level. But it doesn't mean that we're going to go straight up, and it's not a linear path. It goes around and around, and you're going to have good days and bad days, and you're going to be expanding and contracting, and it's a very messy process. It's not perfect. It's not like A to B to C to D. Sometimes it's A, B, C, and then back to B, and then up to E, and then back to C. You know, it's kids and adults have good days and bad days, and it takes practice and patience to get to the point where they can be consistent, right? So, you know, I mean, you think about when babies learn to walk, if they gave up every time they fell down, they would never learn to walk. So why do we constantly, you know, for our older children, why are we constantly telling them, no, you're not doing that right? You know, I know, because I haven't had enough practice with it yet, you know? So just giving them time and grace and then when they do it right, helping them see what they did to do it right, like helping coach, like giving that coaching sort of mentoring support to say, wow, that went really well. What do you think? How do you think you did that? How did you do that better that time? Whatever it is, whether it's with anxiety, depression, or academic progress or anything. So, so important to have that mindset. I mean, like with my son, so he does self-harming and he still will do it occasionally, not to any degree that he used to do. And so he's got scars on his arm from where he has self-harmed in the past, and I'll look at them and I'm like, I can see the scars there. But like once in a while he'll self-harm, but it's very rare now, you know? And to me that's huge. I'm not going to freak out or flip out if he does some self-harm. I'm just going to say, wow, okay, so you were really depressed today or really upset. What made you feel like you needed to do that? Let's go to the root and talk about that. Let's not talk about the self-harming, because self-harming is just a symptom. It's just something that he does when he's stressed out. Other people eat sugar. Other people smoke. You know, some people drive fast cars. Like, people have different coping skills that they use. This kid uses self-harm, and for me not to like freak out about it and get into the whole, how am I going to get him to stop self-harming? If he feels less anxious, he'll stop self-harming, right? So yeah, great point. Anybody else want to share? And this is kind of open. I do have a few more points and then we'll close here in a little bit, but any other thoughts on any of these, what doesn't work and what works, or questions about what to do in any scenario, any specific situation?
Can I make a comment, Miss Sandy?
Absolutely.
I was just thinking about how when I was a teenager and I was depressed, and even now, and after having therapy, medication, and all of that, and still sometimes feeling like that. And my husband has learned not to ask me, why do I feel depressed? Because sometimes I don't have an answer.
Right.
I'm just like, I don't know. I just don't feel up to myself.
Yeah.
You know, sometimes it's a confluence of things. Sometimes it's just one of those days. But I appreciate that he's learned that, because earlier on in our marriage, he would be trying to fix it. And I'm like, there's really no fix sometimes. I just feel this way, and that's how I feel. And as a teenager who experienced that, and having old-fashioned parents that thought kids couldn't be depressed because they had nothing to be depressed about, I just want to say to all parents who have teenagers, and especially with everything going on in the world today, yes, they can be depressed. It's real. And just be there for them.
Yeah. I love that. Thank you so much for sharing that, because we all were teenagers at some point, right? And so we know that that's a time of great pressure and great self-esteem fragility, right? Like, the kids don't know who they are yet, so they don't have that strength of knowing who they really are to be able to be solid. And so they're constantly being pulled all these different directions and being told this and that and trying to find their way. And so, yeah, there are lots of reasons why kids can be anxious and depressed. And then nowadays, I think it's even more because they have access to so much more through social media, through, just for a lot of reasons, they're more in touch with things that are depressing in the world. I don't think I was that aware of world events as much as our kids are today. So it's a lot, it's a lot. And so, like you said, just being there, just being present and being radically accepting of exactly where they are, not giving up hope, but not putting a lot of pressure, just being a calm anchor in the storm, I think makes a huge, huge difference. And sometimes that's all they need. They don't need advice. They don't need to be fixed. They don't need anything. They just need somebody who cares and who's there. Beautiful. Other thoughts? And if you think of something, I'm going to go back to share screen, but if you think of something, you can pop it in the chat, or you can jump on, interrupt me if something comes up. All right, so crisis. We got to talk about crisis before we leave. I do a whole training on suicide prevention and what to do to intervene for that. So if you're interested in that, you can reach out to me. If you become part of our trauma-informed changemakers community, That's included in your membership. So I'm going to be doing those most likely on a quarterly basis, like every 3 or 4 months or so. I'll be doing a suicide training. It's called QPR suicide training, and it's you'll actually get a certificate that you can use if you are an educator. Most educators are required to do suicide prevention training every so often. So this is one of those evidence-based programs if you need that for your teaching certification or for any other job that you have to do suicide prevention. It's also great, of course, for parents to have the tools of what to do when you are in crisis and a child is talking about suicide or ending their life or self-harming to a point that you think it's dangerous. So when kids have suicidal ideation or their behaviors, or they have extreme panic attacks and anxiety, it can affect obviously their life, like it could be life-threatening, or it can affect their quality of life. If they're so shut down and they're so anxious, they can't even leave the house, for example. So you do need to reach out. If that's the case, it's important to look for resources, get the training, talk to people who can help. There are crisis lines. I'm not going to list all the crisis lines here. This is one of the most common here in the US. If you're not in the US, you can just Google your local crisis line. Just type in suicide crisis line and the name of your city. Usually it's either a national line or a local line that you can call to get help. I think we need to give our kids access to those lines. There's another one I didn't put on here, but 741-741 is a text crisis line in the States. Find out if there's a text crisis line where you live. A lot of times kids would rather do text messaging than do phone calls. But making sure that we are letting people know that those things are out there, that there is help, they have access to get help for a crisis situation, and then utilizing them ourselves. I have called the crisis line myself multiple times, not because I was feeling suicidal, but because my son was so depressed that I was getting depressed and I didn't know who to call to talk to about it. I felt like I was talking to my sister a little bit too much about it. I didn't want to bring her down. I also didn't want to call her in the middle of the night. So if it's the middle of the night and you don't know who to call, you don't know what to do, go ahead and call the crisis line. That is what they're there for. So I would encourage you to use that resource yourself and also make it available to anybody in your family or in your school that you think could use that. Post the numbers around so people know where they are. In our model, I mentioned the Heartstrong model, this first rung of growth and healing is crisis to compassion. When a child or a teenager is in crisis or an adult is in crisis, the first step is to have compassion for them, not to try to fix, not to try to convince them of anything, but just to have compassion for how they're feeling, moving them then from chaos to a sense of calm, having a calm nervous system being that anchor for them in the storm. And then we move up to the next level of growth and healing. And in our Heartstrong system, we always want to approach children and teens with honesty, empathy, acceptance, respect, and trust. And then we build strengths-based training for resilience with optimistic narratives of growth. That's what the Heartstrong acronym stands for. And then this is our spiraling stages of growth. I do a whole bunch of in-depth training on this in our programs, but you can see we start with crisis and we move all the way up through regulation to building our relationship, building better reciprocity and communication, and until the child and the adult both feel resilient and strong and able to cope and have a good life, have a high quality of life. So it's important that we remember the power of co-regulation. That just means being in isolation, you can't really heal. Children can't heal on their own. Families can't heal on their own. We need to have each other and have each other's backs and support one another. Get support for your journey. If you feel like you are in crisis and you're alone and you don't know what to do, reach out to your local resources, reach out to your school resources. And if you don't have local resources, you can always reach out to me. I'm a parent coach. I'm also a trainer. I have a community that you're welcome to learn more about, to join us. And if you want to help others, we also provide training for trainers who want to do this kind of training as well. So let's recap what the goals were for this training. We wanted you to understand the prevalence and challenges of childhood anxiety and depression, recognize the warning signs and symptoms, avoid what doesn't work and do what works, find hope and healing even in the most challenging circumstances, gain perspective and know that you're not alone, and then learn about options for further learning and support. So I want to tell you about those again. If you want to take a screenshot of this, or if you're listening to the recording later, you can always do it then. This is how to follow me and get involved. We have 2 support groups online that are free. We have Heartstrong Parenting, Heartstrong Teaching. We also now have a paid membership program, which is the Trauma Informed Changemakers Book Club and Community. We meet monthly for workshops like this, and also we have monthly fire circles. We're having a fire circle tomorrow where we will get together, gather, talk about strategies, talk about what's going on in our lives as teachers and parents, read books together, discuss what we're learning about in the books that we're reading, and just really, it's going to be a place of growth and healing for the adults that are supporting the children. So let me know if you want information about that. We also have a trauma-informed specialist certification for those of you who want to go on to do training or to use this information in your own practice as either as a parent or as a teacher. Maybe you're wanting to be a parent coach or be a trainer in the schools. That's something that will be the first foundation to moving towards that. And then we do have a more advanced program for those who want to be certified educational trainers or certified parent coaches. And for those of you who just need a little help with your own parenting, I do have very limited, I usually work with only 1 or 2 families at a time, but I am still doing some private parent coaching. If my parent coaching slots are full, I also have parent coaches and educational trainers that have been trained through Heartstrong who are ready and willing to serve you as well. So I can make a referral to them as well. All right, so I want to just give you an opportunity if you have any further questions or comments before we go. Let me see, there's somebody wrote in the chat here. Oh, Canadian text crisis line is 686-868 for Canada. So you want to, what I tell folks whenever I do a training like this, go ahead and put it in your phone. Like whip your phone out right now, right? Crisis line, put that text number in there, put those phone numbers. You can Google them. There are special crisis numbers for, like the Trevor Project is a crisis line for LGBTQ youth. There's a veterans crisis hotline for veterans. There are, there's different crisis lines for different communities. So just do a little research for your local area to see what your crisis lines are, and then put them in your phone so that you have them, maybe for yourself or maybe for somebody. You never know when you're going to come across somebody who's going to need that information. So just have it on your phone so you don't have to Google it, or you can always Google it if you need to. Okay. Well, I hope this was helpful. So in the chat, write one takeaway, one thing that you either learned tonight or that you already knew, but you really just want to remind yourself to continually be thinking about it. What was one golden nugget or takeaway that you're going to leave this training with? And let's put those in the chat and I'll just read them out. Type one, something that someone said or that I said that really kind of struck you that, yeah, I need to keep reminding myself of that. Progress, not perfection. Radical acceptance and gratitude. Rejoice in the little things. Trust your parent gut. Absolutely. Celebrate and drop the rope. Yeah, don't get into. The only time I really get firm about things is when it's a safety issue. Everything else is negotiable, pretty much. Just drop that rope. I have a big gut, so it really should help me more. That's hilarious. Yeah, that's awesome. Be an anchor for your child, student, or your student. Meet your own needs as well. Big time. I didn't use the dreaded self-care word, by the way. I'm avoiding self-care because I know right now it's very triggering for people to be told to do self-care. because who has time for that right now? But the way I conceptualize it is just what makes you a well human being? What keeps you well? That could be spiritual wellness, emotional wellness, physical wellness, relational wellness, friendships, all of those things that make you a human being. Make sure that you keep that balance. And if something's out of balance, really strive to get it back in balance as much as you can so that you're operating from a place of wellness to provide an anchor of wellness for someone who's not doing well, right? All right, everyone. I appreciate your time. I hope this was helpful. I hope to see some of you tomorrow in our fire circle. If you want information about how to join us, just send me an email. I look forward to seeing you there, and have a great rest of your week. Take care, everybody.